It began on 211 acres of land set in the foothills of the Sourland Mountains in central New Jersey. The Certificate of Incorporation stated its purpose was to establish and maintain a colony for the care and treatment of sick persons, and particularly for the care and treatment of nervous and mental disease. That was 1910. Today, 100 years later, still located on the same acreage in Belle Meade, is the home of the largest private, not-for-profit behavioral health care system in New Jersey, an institution with national recognition for the advanced care and expert treatment to those struggling with psychiatric and addiction disorders. A healthcare system where hope is restored and recovery begins. This is the story of Carrier Clinic, a source of hope, help, and healing for over a century. Known as the Belle Meade Farm Colony and Sanatorium from the day it opened its front door, it proved to be an ideal location for providing humane, personal treatment in a restorative farm setting. The Kindred family was the first and second generation of owners and operators, Dr. Joseph Kindred, and then continuing the legacy, his son, John Kramer Kindred. A growing enterprise of several buildings interspersed with the continued operation of a farm produced an environment worthy of their promotional copy of the 1920s. The appearance and effects of the grounds and buildings are those of a liberally planned country home surrounded by varied scenery of beauty and interest. Every facility is offered for the scientific treatment, kind nursing, and modern care of nervous patients, alcoholic and drug habituates, including both voluntary patients and committed cases. Though the Belle Meade Farm Colony grew in reputation as it catered to patients from the New York City and Philadelphia area, its regional and national reputation can be attributed to the vision and dedication of Dr. Russell Carrier, the brother-in-law of Dr. Kramer Kindred. With his extensive experience with electroshock therapy, ECT, and certificates in psychiatry, Dr. Carrier became the medical director in 1951. In 1956, Dr. Carrier purchased the sanatorium, changing the name to Carrier Clinic. Now, the vision and creativity of Dr. Carrier and his staff set into motion the process which brought about a remarkable transformation. What emerged was the framework that defined a modern psychiatric hospital, centering on short-term intensive treatments. What became the guiding principle for Carrier was the maximum in-hospital treatment, the minimum in-hospital atmosphere. Dr. Robert Garber, who was considered largely responsible for Carrier Clinic becoming nationally known in the field of psychiatry, took over as medical director in 1958. A hallmark at Carrier established in the 1950s has been its innovation in education, starting with a varied psychiatric program for physicians. Topics included violence and aggression, adolescence and drugs, alcoholism, depression, psychiatric drugs in medical practice, and more. In the 1960s, the Carrier Clinic was expanded into several patient units. This is the beginning of what was to become the current configuration of the inpatient facilities. By 1968, there were 179 inpatient beds. Also in the mid-60s, Carrier Clinic was expanding its reputation for solid research and was chosen as one of 20 hospitals throughout the country to test manic patients with lithium, now the standard treatment for manic depressive patients. In 1971, the Addiction Recovery Unit became the program for treating addicted patients. Based on the philosophy of Alcoholics Anonymous, it stressed a model of treating alcoholics and other drug dependents with intensive education using both individual and group counseling as well as psychiatric treatment. In 1972, a new wave of building commenced. Carrier Clinic added 3 patient units, affording a new total of 250 beds. Administrative changes were also taking place. Dr. Carrier retired in 1973, and Dr. Garber became president of the Carrier Clinic. In 1977, Carrier Clinic became a private, nonprofit organization, and its research programs increased, including the clinical use of computers to collect information that a psychiatrist could use in diagnosis. Other programs included additional ECT research and treatment programs for anxiety, depression, and mood disorders. specialty units now exist for adolescents, adults, and older adults. In 1981, Blake Hall was built with a program for the dedicated purpose of treating patients with addiction problems. In addition, the Carrier Day School, now East Mountain School, was established to serve 9th through 12th graders with serious emotional problems. Here, troubled adolescents would benefit from their own separate facility and special programs, combining academic study with therapeutic care. The East Mountain Youth Lodge was established to serve adolescents with psychiatric problems who could not live at home or in the community. In 1982, a physical therapy department, an affective disorders program, and a behavioral medicine program was formed to aid both inpatients and outpatients. All the hospital programs were supplemented by adjunctive therapies that included creative arts, art, music, poetry, movement and drama, therapeutic recreation, games and sports, cultural, leisure, and educational activities, vocational and educational counseling, occupational and horticultural therapies, and pastoral services. By the mid-1980s, the multidisciplinary approach of Carrier focused on the special needs of people in trouble, combining therapies in such a way that each contributed to helping the patients work through their problems. These approaches included an anxiety disorders program, mood disorders program, eating disorders program, adolescent program, senior treatment and evaluation program, and addiction recovery services, including the Blake Recovery Program and Dual Diagnosis Program. As Carrier entered the 1990s, managed care began to make its presence known with the challenge to find new and creative methods to treat patients and move them to a stable, functioning level quickly. This influence led Carrier Clinic to develop several outpatient centers throughout the state of New Jersey. By the end of the 1990s, Carrier had become a behavioral health care system with an inpatient facility in Belmead and a regional network of 9 outpatient centers. Through partnerships with the community and state, Carrier Clinic continued through the 2000s to share its clinical knowledge and expertise. Through collaboration with other state mental health centers, the 2000s saw Carrier refocus its priorities on enhancing clinical treatment programs at its Belmead, New Jersey campus. In 2002, Carrier Clinic developed East Mountain Hospital, a hospital within a hospital. This 16-bed facility serves patients who have a long history of mental illness and need short-term hospitalization during exacerbation of their illness. The Caring Solutions Initiative was started in 2004 as an effort to reduce the use of restrictive measures such as seclusion and restraint. The CSI model became an active clinical strategic initiative at Carrier, which focused on a patient satisfaction approach involving patient engagement, mutual respect, and trauma-informed care. Carrier announced an affiliation with the Robert Wood Johnson Health Network in October of 2004. The affiliation allows for a collaboration of ideas and medical and psychiatric expertise, which promotes enhanced quality service for all patients. 2006 marked the beginning of the equine-assisted psychotherapy program at Carrier Clinic. Similar to pet therapy, equine-assisted psychotherapy is an experiential opportunity to identify, work with, and work through various feelings that can surface while spending time around horses. Throughout the last decade, expansions of specialized programs and projects continues to define Carrier Clinic as one of the premier facilities in the Northeast. The Intensive Outpatient Program for Addiction, the Active Seniors Program, the Carrier Diversion Program are just a few of the innovative programs now at Carrier. Our innovations don't confine themselves only to healthcare. Carrier Clinic held a groundbreaking ceremony on September 30, 2009 to celebrate the construction of a 14-acre solar farm on campus. It is expected to supply 50% of our electrical needs. This is the largest of its size for any healthcare system in New Jersey and is unprecedented for a behavioral healthcare system within the United States. Today, Carrier Clinic holds true to the values it began in 1910 by our founder, Joseph Kindred, and nurtured by Dr. Carrier. For 100 years, our compassion, respect, integrity, and innovation has been returning individuals back to enjoyable and productive lives. Carrier Clinic is proud of a century of service and now stands ready for another 100 years of hope, help, and healing.